All right. Back like we never left.
I know, right? I started doing a whole bunch of other stuff though.
You did, my bad. We won't do it too much more.
Not in a bad way. I'm just saying I wasn't by my ring light or none of that. I was in a whole nother area. I used to be outside on Thursday nights, but I told you I've been eating differently and being haven. So I'm like, no alcohol tonight.
That's good. That's good. Be good.
So Thirsty Thursday wasn't on the radar tonight.
That's all right. Your body thank you for it.
I know. That's why I said I was behaving for a change.
So what I guess we get back to these questions.
All right. So if you were in the part one, I did screenshot the questions before we left. So I do have you guys on the list. But if you're joining because you weren't in the first section, please feel free to send a request to join the live. Or if you want to add a question, then there is a comment bubble at the bottom of the screen with a question mark in it. Please use that because then stuff like this happens. You got to run. I still got your question.
And if you hop on the live, it's like free healthcare, like I told you. And, you know, I answered whatever you need me to answer.
Yes.
That's what up.
All right.
She said, I look tired, huh? Yeah, it's been a rough ass week. I know I look a little whooped. It's turn up weekend this weekend though, you know. So it's Super Bowl party. You know, it's gonna go down on Sunday. So yeah, I'm gonna get my energy.
So who you rooting for?
That's a good question. I'm kind of mixed on it. I like there are two stories on each side that I really like. Well, one, both black quarterbacks, but Jalen Hurts, frat brother, and his whole story, like everybody just counted him out. Like they screwed him over in college, they tried to screw him over in the pros, and just to watch him like persevere through it. She said, "Go Buffalo, stop." To watch him persevere through it, and I would like to see him win. But on the flip side, I really like Andy Reid. Like Andy Reid, honestly, is like to me kind of like the he's the Greg Popovich of NFL. If nobody knows Greg Popovich, he's like NBA coach, but he down for black folks. Andy Reid, if you follow him, he down for black folks. He is down for the cause. You know, he gave Mike Vick another chance. He stuck with Donovan McNabb. He's all about helping brothers. So I really like him. I like Eric Bieniemy. I know I'm messing his name up, but he's also the offensive coordinator for the Chiefs. They've been screwing him over and not giving him the head coaching job. So it's all love. There's a lot of black excellence on both sides. As far as who I think will win, I can't. Like Patrick Mahomes is special. It's a special dude. It's like betting against Brady. So I wouldn't bet against the Chiefs. So, but I think it's going to be a phenomenal game, though.
Yeah, I think it's going to be a good game, too.
I want to watch for once. I'm usually always, like, entertaining and, you know, walking around my party, make sure everybody go, like, look, y'all come, y'all, man. I'm watching the game.
Yeah,
on Sunday.
This is one of them ones that you actually will want to watch.
Yeah.
All right. Well, let's jump back into it. So, where we left off, is there an age limit for one to carry a child after egg freezing?
No, it's not. There isn't. It really just depends on how your REI or your fertility specialist, what their philosophy is. A lot of that. Now, as far as like them actually going through an IVF cycle, a lot of them won't do it past the age of 50. But as far as if you had your eggs or what have you and actually implant fertilized eggs in, that's a different story. That will be beyond 50, but it really kind of depends on your health, one, and your team of doctors. But yeah, you can. There's really not an age limit. Now, obviously, once you start getting in the 60 rounds, like there are women that do it, but every doctor is not going to be too amped to do that because you just have a higher risk of complications and stuff that people just don't want to take those risks on. But there's really not a technical age in which you can't um, have implantation, um, if
If
you
you
will.
already had an egg.
Somebody wanted to hop on this live.
All right.
I don't know if she is or not. Hello.
Hello.
How are you?
Hello.
Good. How are you?
I'm great. How are you? I'm good. I had a couple of questions. So I have hypoprolactin.
Anemia.
Hypoprolactinemia. That's it. With the high with my gynecologist, he act like it was no big deal. So when I had my numbers done, I gave it to my
You have hypo or hyper?
my hyper.
It's too much.
So it's high.
Okay.
Yes,
Okay.
too much. Hyper. And he didn't think it was a big deal, so I gave my numbers to my general practitioner. And
Uh-oh.
She froze. Something happened with her connection.
Oh, her connection dropped.
Yeah. She caught up. She coming back.
Okay.
There she go. All right. Welcome back.
Okay, sorry. My name is Hannah. Anyway, so when I gave the numbers to my general practitioner, he was like, okay, well, we're gonna run some more tests, and so he put me on medication to lower it. It didn't. It wasn't satisfactory to him, so he sent me for an MRI. So it was characteristics of someone who had the tumor on the pituitary gland.
Yeah.
So when I went back for one of my visits to my gynecologist, he wanted to put me in a test study to shrink my fibroids. I'm sorry, I have fibroids. And I was like,
what type of test study?
That's the thing was when I was trying to get detailed information about it, what was it? Was it a hormone? What kind of medication it was? And he got an attitude with me. So yeah.
Get your purse.
And that's what I did. And it's kind of frustrating because I want to find another doctor here in where I am. But if I have to, I can travel.
Where you located?
I'm in the Metro Atlanta area. Okay. So he's supposed to be one of the premier gynecologists, especially in reproductive health, also dealing with fibroids and all that. He's been practicing longer than I've been alive. I think he started in 72 or 73. But it was kind of frustrating that he reacted towards me like that. I was like, I'm not sure if that will upset the situation that I'm in now. And then the mere fact that he didn't take it seriously. When I gave my numbers to my general practice, he was like, let's look into this more. Mm-hmm. So it was kind of frustrating with that. And then when you were speaking about the fibroids, I went in 1 month, one doctor's session appointment. It said I had 6 fibroids, and then when I went back, it said I only had 5. And then yeah, that's what you were saying. So I was like, well, maybe it was still there. I had
probably got more than that,
right? And I had surgery. I had surgery. Was it 12 years ago.
Yeah, the
12 years
what
ago, I
you
had a mom. I had
have?
the Da Vinci or the robotic arm or whatnot. I don't believe all of them were taken out. So,
Correct. I
so
I can assure you they weren't.
it did help, but that was one of my concerns is that you have to be very proactive to a lot of the people that are listening that are affected by fibroids, that you really have to ask questions, because he just thought I was going to say, oh, okay. But when I asked for questions, when I asked for a pamphlet so I can read about what is he giving me, I didn't know if he was going to give me another hormone, because I was on birth control for like 10 years.
Mm-hmm.
And I didn't want to take more hormones, and it could, upset my fibroids, upset my heart rate, upset whatever else is going on with me. So
Mm-hmm.
that's one of the frustrating things is I wanted to make sure a lot of the women speak up for yourself, because it's scary that they will bully you into, because I was bullied into taking birth control to make my fibroids shrink. That's how it was, but that's how it was relayed to me. So
That's crazy. That's crazy. Yeah, when my biggest advice to you is when things don't sound right, that means they're not right. Always and I tell people, I was having this conversation with someone very recently where because people if the doctor tells you how do you know who to trust? How do you know who can you trust? And I say like this, common sense, it ain't always common, right? If somebody is breaking something down for you and in your gut, you can understand it and it makes sense to you and you trust, and then you gain a trust for that person, go with them. If somebody's breaking stuff down for you and your common sense is telling you that don't sound right, that doesn't make much sense, and then you ask subsequent questions and they either get the fumbling over it or the explanations get more unclear, then that's the person that you don't go to. That's how you pick out if doctors are good for you or whatever. And this is for everybody. It's very easy for them to bully you, or to feel bullied like that. But realize you are in ultimate control over all decisions, right? I tell my patients this like this all the time. This is a conversation between us. And at the end of the day, I'm going to tell you everything that you have option wise. I'm going to tell you my opinion about them. And if you want more about why my opinion is what I'm going to give it to you. But at the end of the day, after I finish talking all of this, the decision is yours to make an informed decision. And I've had women that I wholeheartedly didn't agree with what they were wanting to do. I wholeheartedly said this doesn't make sense. But at the end of the day, I have to honor their wishes, because at the end of the day, it's your body, it's your life. It's, as long as you have been appropriately counseled, you are a grown person and you can make your own decisions that make sense for you. But if you're not getting those things, then you need to seek other options and for a provider. And as far as shrinking fibroids is concerned, that is the most biggest misconception there is. And I'm going to explain. Whoever's asking me about they spending $300 in teas for fibroids. You might as well just give me that money. Let me talk to you, okay? Because you are wasting your money and your time doing that. Big waste of money. But in back to response to what you were saying, you have multiple different things that are going on. And I'll be totally transparent to you. As a gynecologist, I know what hyperprolactinemia is. I know how to treat it. I'm not well versed in treating it, right? So I know, a good doctor knows their lane. We stay in our lanes, right? Women's health, fibroids, that's my lane. And that's for most gynecologists. When you start talking about endocrine stuff, that's a different lane. So I don't make a lot of judgments, even with thyroid stuff that I treat and I give medications for, whatever. Mm-hmm. When an endocrinologist says something or when it gets out of my wheelhouse, I'm going to listen to a specialist that deals with that. Just like if you went to your endocrinologist about fibroids and they start telling me, oh, well, you have this option or whatever, stay in your lane, my friend, right? That's my lane, right? It's that thing. So when it comes down to that part, you definitely need to listen to the people that treat that all the time. And even with your generalists, they have a particular lane too. When it gets outside of that lane, you need to be given to an endocrinologist that deals with that on a regular basis. Right. And that's what I would recommend as far as that's concerned. As far as like your fibroid issue is concerned, I would really have to see your ultrasound to see where they're at, if they actually need to be treated or what have you, because a lot of times women have fibroids and they're not at a point where they actually need to be treated or anything done with, right? They probably are not causing you to have, bleeding or any issues. Prolactin issues can cause you to have bleeding problems, right? So you deal with those things first before you start going in, making surgery on fibroids and those types of things. And you bring up to a bigger point that I give people all the time, and I have to preface it by saying that I am a robotic surgeon. The robot is made by Intuitive Surgical, right? It's the Da Vinci robot. They pay me. I'm on their payroll to go and teach this surgery all over the country. With that being said, I'm telling everybody, I don't believe in robotic surgery for myomectomies. It's just not. Simply for exactly what you're saying. You don't get all of them. And if you don't get all of them that you can see, they're going to be there. Same way you just said, somebody said you have 6 fibroids and somebody said you have 5 fibroids. I'll guarantee you got 10 or more fibroids, right? As a radiologist, they're going to mention the ones they feel like that are significant, the ones that are close to the lining, the ones that are big enough to even start mentioning. They're not going to mention the smaller ones. They're not going to mention the ones that just may not be very visible on a particular slice of an image, right? So don't get caught up in the number. Focus on the symptoms. If you're having bleeding, pain, infertility, pain with sex, urinary frequency, those types of things, then start to looking to see if these fibroids are causing those things, and then start looking at treatment options for them as it pertains to the symptoms that you're having, as opposed to, do you got 6? Do you got 7? Is it 5 centimeters? Is it 7 centimeters? You could chase that rabbit hole all you want. It's just going down a rabbit hole, and it's not going to be, very beneficial for you. First things first, it's just a seeing about the prolactin level. I'm not privy to your lab, so I can't see, but I will tell you that small amounts of you can be mildly hyperprolactin, and you can be excessively hyperprolactin. Right. Usually like the milder hyperprolactins, you don't necessarily need to treat, but when it gets to a higher level, that is impacting other things. So when prolactin levels are extremely elevated, they start to make the other hormones in your body off whack, because basically everything in your body, from your ovaries, every gland in your body, your ovaries, your adrenal glands, your pancreas, your thyroid, your parathyroid, all of these glands that produce these hormones for you to function, they originate in the brain. Mm-hmm. And it's a big communication system where the brain sends these hormones down to the particular glands, and then the glands send hormones to control the functions of your body. Mm-hmm. These hormones are very, very similar in structure, meaning when one is really off whack, it can cause the other ones to be off whack, because they're so similar that they can cause glands to produce hormones when they're not the ones that should be receiving the signals. Okay. So that's where it becomes important to treat it, when things in your body are not regulated and it's throwing off things. Just like with the hyperprolactin, it can cause you to not have periods. It can cause you to be infertile. It can cause you to not be ovulating regularly. It can cause all of the different types of things that are triggered as a cascade effect, all because of the prolactin levels off. That's when you need to treat it. It's a helpful.
Okay.
I said a whole bunch. I don't know if that actually answered your
Yeah,
question.
you said a whole bunch. I was just shocked that my gynecologist was like, no big deal, and my general practitioner was like, no, you may want to check that out. The earlier that, I think I was like in the low 200s or something like
Yeah,
that.
that's a little too high. That's too high.
Because it's
So,
supposed to be like in the low 10, less than 10
yeah,
or something like that.
anything over 100 is
Yeah.
concerning. So as a gynecologist, that would be me to not say, hey, that's not a problem. Yes, it is a problem. It's abnormal. And I'm going to send you off to your generalist so they can look at it and determine whether or not you need to see an endocrinologist or not. So, yeah, just be kind of wary of that. I don't speak bad about I don't speak bad about any doctor or what have you, but just be leery about people that kind of speak out the side of their necks about stuff. Oh, you
Okay.
don't need that. Oh, you have this. Oh, no. Like, I'm very clear about the things that I'm very good at and things that I know and the things I don't. I know a little bit about everything, but I know a lot about certain things. And the things that I don't know a lot about, I will punt off in a second. People start asking me about neurological stuff or like, brain tumors and stuff. My line brother's a neurosurgeon. I don't start asking. I look at him and be like, oh yeah. And I'll send a text messages off. That's not my lane. People got to stay in their lane. That's the biggest issue. And
Okay.
as far
All
as
right.
Atlanta, Dr. Hawkins is in the Atlanta area. She does specialize in fibroids too. Um, uh, I would look her up if you're trying to stay in that area. She's one of the few people that I say is really good with fibroid therapy. Her last name is Hawkins.
Okay, I wrote it
Yeah.
down.
Look her up. See, I don't know what her availability, insurance, and all that stuff like that part I don't know. So if it doesn't work out, you just reach back out to me. I'll be happy to care for you. But just let me know.
All right. Thank
Cool.
you.
You're welcome.
Bye, y'all. Thank you so much.
You're welcome.
Thanks for joining.
So Miss Kelly Diane, you just wasted your bread, mama, with spending $300 for some tea. You'd have been better off going to Starbucks and getting a refresher. That money you just spent was somebody taking advantage of your lack of knowledge about this stuff. There's not a tea. It's not and people will say, you don't know. Yes, I do. I know. Sea moss, elderberry, you can take smoothies, you can do all this stuff, everything you want. You could pay whoever you want this money. It is not going to shrink these fibroids. It has nothing to do with your diet. You could go to a vegan, vegetarian, pescatarian, keto, paleo, all that stuff is not going to shrink. It'll help your general health, but if you're looking for some miracle magic thing that's going to shrink your fibroids, you're not going to find it. I operate on everybody. You name the diet, I operate on them. You name the activity level, fitness experts, personal trainers, you name them, I operate on them, right? So I know firsthand that these things don't work. If they did, I'm not a hater. I would tell you. In fact, I would slap my name on something and make that $300 that you're spending real easy. I'm not opposed to making money, but I'm not going to sit up here and lie to you and tell you that something works when it doesn't work and it's not, and it's been proving to not work. So please, guys, be wary, right? If I came and just start selling or start telling y'all I got the best, extensions and eyelashes and I'm better than Cola at doing hair or whatever, y'all, what y'all gonna tell me? I lost my damn mind, right? All right, so don't
Stay in
listen
your
to
lane.
somebody. You just stay in my lane, right? So don't listen to somebody that has absolutely no medical knowledge trying to sell you something that they claim is going to do something. Y'all won't take the shot, the vaccine, you won't take different medicines or whatever, but you're gonna drink some damn tea that somebody made to fix your fibroids. I seen a dude just straight off the street was telling women about their bodies. Like he was doing a whole IG about, you know, women's bodies and everything. Had his little, you know, he looked like he was coming. And I'm not stereotypical. I'm the last stereotypical dude, but dude looked like he was straight out the pen, just talking. And people was just on there, yeah. Like, anybody gonna check his credentials? Y'all check my credentials. You know, y'all check me, Google me and everything else, and I'm talking or whatever. And y'all not checking none of these yahoos that just sell you any damn thing on the planet and tell you that I'm crazy and I don't know what I'm talking about. I just want to cut off women's body parts and everything. I'll go listen to all of that stuff, but y'all are not fact checking these people and using your common sense to know that this is a capitalistic society. If you're ignorant about something and there's a need for something, there is an opportunity to make a lot of money off of ignorance. I'm gonna leave it there.
Yes, it does. All right.
It's my chop, bro. What else, Bonnie?
All right. I am a Jehovah's Witness, so I do not believe in taking blood. Do you offer blood transfusion alternatives during your surgeries?
That's a tough one. That is a tough one. That is a very tough one. So it really comes, well, there aren't really many alternatives to blood products. Like if you look at plasma, albumin, fresh frozen plasma, like all of these are some type of derivative of blood products. So I don't know deep into the religious aspect of what people take and what they don't, but most of those are some form of blood product and that people will deny. When it comes down to surgical necessity, then meaning that you have to have the surgery or you are at risk of being extremely ill or dying, then people like myself are more apt to doing it. I will repeat, myomectomies for the preservation of your uterus is elective. What does that mean? Just like pregnancy, you elect to do it. That means you don't have to have that. So if you are seeking to have a uterine preserving surgery, which is totally elective, and it is an extremely bloody surgery, all of these fibroids and things have blood supply to them. It's a very fine balance about what's going to be offered to you as far as surgery wise, because I'm not going to be very amped or very excited about performing. I had a lady like this that led me down a whole rabbit hole. Like, number one, it was a totally elective surgery, right? She's, you know, menopausal, but she wanted to keep her uterus. I can't make this stuff up.
I'm not gonna laugh.
I promise I can't make this stuff up. She called me because I'm the fibroid slayer and I can always preserve her uterus. I said, okay. She hit me with the one, you are postmenopausal. You're not having periods anymore. It's just that fibroids are causing you to have issues, which is fine. But you want to preserve your uterus, which is now an elective surgery to do that. As much as I don't want to do that, I would consider it because that's your body, that's your choice. Where I drew the line is she said, oh, and I'd never want to have any blood products or anything, whatever. So not only do you want an elective surgery, but now you want me to risk your life and my livelihood on you doing something that's elective and not safe for you, whether it be religious or anything else. At the end of the day, it's an elective surgery. The answer is no, I'm not. I'm good with that. My kids would not appreciate me risking their livelihood because you just want to do something. You know, now if it comes to a point of these fibroids are plaguing you, you are Jehovah's Witness. You've tried other medications to try to, you know, counteract it. It's just not happening. You need to have a hysterectomy, but you don't want blood products. That's different, right? That means there's a necessity surgery needs to happen. And I need to take the precautions to doing that. And we need to go through the risk and benefit of you in saying that, hey, if this happens, you don't want any type of blood products or what have you. You'd rather die. And if you understand that, then we can go into it. Hold on a second. Hello. Okay.
Busy night tonight.
Busy night. Beautiful, beautiful. They'll be all right in a second. But yeah, that's that. That's the thing about that. It's just like, you know, as far as blood products and stuff are concerned, you run, it's a very fine line between elective and non-elective surgery.
All right. How do you feel about issue removal by salpingectomy?
I am totally a proponent of it, meaning that I'll do it. I actually have one scheduled for in a couple weeks of a high school classmate of mine that has had pain from that everything looks normal other than Esher coils, and you know, narrowed everything else down. Everything else looks completely normal, and the decision is to remove her tubes for these Esher coils. So yeah, I'm definitely on board for it if it is determined that is the problem. Sometimes it's like you may have pain, that's not the problem, but you just want to take them out just because. I'm not as excited about that. But a good exam, a thorough exam, and thorough history of the patient will be able to narrow down if removal of the coils from a salpingectomy makes sense for a particular person or not.
All right. I had an ultrasound and my gynecologist noted a 5-centimeter fibroid within the uterine wall and another smaller 2-centimeter frontal. At the moment, she wants to watch the smaller one and remove the bigger one. What is your opinion on a DNC for the bigger one?
So the DNC is more so a hysteroscopic myomectomy, which is removal through a camera going into your uterine cavity and removing the part that's in the cavity. That's good, but the only problem is that there's still a portion of that within the wall of the uterus. And if you still have a portion of that within the wall of the uterus, that needs to be treated too. It doesn't have to be, but it's recommended. So there are procedures out there like Accessa in which you can remove the part that's in the cavity and also treat the part that's in the muscle too. So that's what I would personally recommend. But removing the part that's in the cavity is an option. But there are other options, I would say. It's not a bad option to just remove what's in the cavity, but just kind of see what else is out there.
Okay. So, do you want me to screenshot or do you want me to?
Yeah, we'll do one more and then we'll screenshot these and save them for later.
Okay. All right. So since you were on the topic of blood, they said, can you collect someone's own blood ahead of time to use during their own surgery as an alternative to a traditional blood transfusion?
Yes, you can. That is an extensive process where you'd have to have hella great insurance and be at a facility that has the capacity to. So taking off a significant amount, which we don't have significant amounts to really give for later, even people that are not anemic, is difficult. You know, for instance, if you have somebody that has a 10, once you take off that pint of blood, you're automatically going to decrease them to a 9 or lower. So it's like robbing Peter to pay Paul. Like you're taking that off, you're going to lose some. You're going to get your own back, but you've lost. You're now at a lower point where you were in the beginning, you know? So it's like, you got to put some more water back in the tub. You can't just let it keep draining out the bottom. At a certain point, you got to put new water in the tub. You can't just keep recycling the same water, if that makes sense. So yes, you can, but it's a process that's it's not very easy, and it's going to cost money to do that. But just from a logistical standpoint, doesn't make a ton of sense, because usually you don't have enough reserve to give yourself in case you need more, right? If you're anemic, you going in, you take blood from an anemic person, you're gonna make them more anemic, even though you're giving them their own stuff back, but now they're more anemic, if you will.
Yeah, because even from a patient perspective, so I was anemic and I had a blood transfusion. I did grow up a Jehovah's Witness, but I'm not now. But my levels was only up the first morning after surgery. So whatever blood they gave me, it lasted a little while. And then it went back to my normal levels until the 3 months where I gained my own regeneration back.
You just got to
so it wasn't,
bleeding.
the levels didn't stay high long, but it did keep me alive during the surgery.
Yeah.
So, all right. Well, I'm a screenshot because I know you got to go.
Let me be great for the night. But we came up with a lot. Like I just said, no big deal. But I'm just looking at some of this stuff. Look at Cola. She done went on ahead and had her whole little. You was doing good. You was doing good.
I don't know why I could never screenshot on the first.
You was doing good. Yeah, Spawn it. Spawn it. Yeah, you could use Cell Saver. You can. You could just like you could use Cell Saver, because my chapter role was also OBGYN. Was just talking about Cell Saver. You can, which is Cell Saver is a tool that we use to collect and preserve blood lost during surgery. You can, but everybody doesn't have that. Like only some very, very high-end hospitals with the technology for Cell Saver have it. So yeah, so it's, yes, it can be done, but it can be more expensive. Yeah, it can be. Cell Saver does work. I've never been privy to be at a hospital that has Cell Saver, other than in residency at a certain point. But yeah, it can be done. There are. So I didn't even really think about Cell Saver because I don't even really use it. I don't have the privilege of doing it. That basically, when you bleed, it preserves the blood that you lose so that you can get it back. But like I said, it doesn't do it all, because you got some of that stuff you're gonna lose. Some of it you're not gonna be able to just suction off in a canister. Some of it's gonna be lost with sponges and laps and excess blood loss to spill out other places. So you still may lose to the point where you don't have enough saved to get that back to the patient. So.
Okay, I got it. I don't know why it wasn't letting me screenshot before. It was player hating.
So yeah, why don't we could do this
not next week, but I think I could do the Thursday after, but next week I can't. So
okay.
So if we
Right.
if we do one more in February, it will be the 23rd. But let me be sure. I'm not gonna say for sure now. I know the 16th is not a possibility.
Okay.
But
all right,
we might be able to do the 23rd.
Okay. That works.
All right. So thank you everybody who joined. I definitely screenshot it if you put it in the bubble. I don't know why it wasn't letting me screenshot the first time. I did get part 1 people too as well. So I do keep the list going, and then you're still more than welcome to DM me throughout the month. I keep the list going, and we will keep doing this as long as the people want it. We are here. So
I will look into Jehovah's Witness blood transfusion alternatives. I will. But even with that being said, I won't budge on safety in elective surgeries. So a myomectomy, again, is an elective surgery. Hysterectomy is not. In some cases, some cases it is elective, but you know, some hysterectomies are needed. Other surgeries are needed. Myomectomies are not, at the end of the day, not needed. They're elective. So when you're talking about an elective surgery and you have somebody that, and I can tell you 99% of gynecologists that like their license and like their livelihood in this litigation filled world that we live in, um, would not be amped to just do that. You know, again, I like my livelihood. I like my kids like my livelihood, and everybody would be loving to sue if they lose you know, they family member because you couldn't get blood products. They lost too much blood. They died on the table, whatever, from a bloody surgery that was elective. People are suing from BBLs. They're elective, so damn sure they're gonna sue for, you know, myomectomies, where it's a whole hospital and a doctor and everything else that you can get money from. Yeah. No, I will definitely I will definitely look into it for sure. I will look into it, but those will be for hysterectomies. I'm not going into a myomectomy for an anemic patient that doesn't want blood products. It's just it's a risk that I personally don't want to take. Other people may take it, and that's fine. I'm perfectly fine to say I don't know all of the alternatives for Jehovah's Witness patients or people that don't want blood products, because I don't have a lot of patients that fall into that category. So I'm fine with saying I don't know enough and I need to educate myself more about it. Perfectly fine. Especially if I did have a patient, I would be looking into those things. But when it comes down to myomectomies that are completely elective and somebody doesn't really want blood, and is severely anemic, I quote, is severely anemic, that's a problem. If you have plenty of blood to spare and in a procedure that you're going to lose a lot of blood and you don't want blood, that's different. Somebody with a hemoglobin of 6 and 7 say, oh, I want to keep my uterus and I got 20 centimeter fibroids. God bless you, mama. I'm not doing that. I'm just not going to do that. Can't do it. Sorry. Either we're going to do a hysterectomy, take that thing out, but I'm not going to risk your life. Can't do it. Just can't. Sorry. That's it. That's my stance. All right. That's it for the day. I gotta
Yep.
go to work.
Duty calls.
Let me be great.
Yeah.
So yeah, so we'll let's get these questions and then I'll send like my information to you if people wanted to donate, give, or whatever. That's fine. I will send it to you. I'm not gonna personally just like put it out there or whatever, because
Yeah, we don't want nobody to think that
he just trying to just take money from the people. I'm really not.
When the man was posting cash out, we don't
Right.
want people to
Exactly.
think.
Hell yeah. Be like, oh no, we ain't doing
Now
that.
he is the putting his cash up.
Oh no, I'm gonna just give it to you. Let you do it.
Yeah, no, I got
it. For sure.
All right.
All right, everybody. Y'all be safe. Keep the questions coming. We'll do this again.
Yeah.
Yeah, until next time.
All right. See you.
All right.
Take it easy.